Your body never lies to you, it whispers before it screams. And the middle of the night, when the world is silent and distractions fade away, is exactly when your body chooses to deliver its most urgent messages. The problem is that most people ignore these messages completely. They dismiss them as normal aging. They blame the coffee they drank too late. They convince themselves that everyone wakes up like this. And then months or years later, they find themselves in a hospital bed wondering how they missed the warning signs that were so obvious in hindsight. I'm Dr. Nathan Torres, and I've spent 19 years in cardiology watching patients describe symptoms they experienced for months before their diagnosis. Symptoms that appeared almost exclusively at night. Symptoms that woke them from sleep in specific patterns that meant something profoundly important. And the tragedy I witness over and over again is that these patients rarely connected their nighttime awakenings to their heart until it was almost too late. What I'm about to share with you could fundamentally change how you interpret your own sleep disruptions. I'm going to walk you through 5 specific ways your body wakes you at night when something is wrong with your cardiovascular system. These aren't vague generalities. These are precise patterns with precise meanings. And by the end of this video, you'll understand exactly what your body might be trying to tell you and exactly what steps you need to take. This isn't about creating fear. This is about giving you the decoder ring for messages your body is already sending. So please watch this entire video, share it with everyone you care about, because the person who needs this information most might not even know they need it yet. Let me tell you about Walter. He was 67 years old, a retired postal worker, and he came to see me only because his wife threatened to sleep in the guest room permanently if he didn't do something about his snoring. Walter thought this was a marriage problem. He had no idea he was slowly dying. For years, Walter had been waking up multiple times per night with a sudden gasping sensation. He described it as feeling like someone had been holding a pillow over his face and then suddenly released it. He would jolt awake, heart pounding, take a few deep breaths, and fall back asleep. By morning, he barely remembered these episodes. He just knew he felt exhausted no matter how long he stayed in bed. His wife, however, remembered everything. She told me Walter would stop breathing completely for terrifying stretches, sometimes 30 seconds, sometimes longer. Then he would make a choking sound and gasp violently before resuming his rattling snore. This pattern repeated dozens of times every single night. Walter had severe obstructive sleep apnea, and it was destroying his heart in ways he couldn't see or feel during his waking hours. Here's what happens during these episodes. When your airway collapses and breathing stops, oxygen levels in your blood plummet. Your brain panics and triggers a massive stress response to wake you just enough to resume breathing. This floods your body with adrenaline and cortisol. Your blood pressure spikes violently, sometimes to stroke-level readings. Your heart races to compensate for the oxygen deficit, and then you fall back asleep, and the whole cycle repeats. 30 times per hour, 40 times per hour, sometimes more, night after night after night. The cumulative damage is staggering. Untreated sleep apnea dramatically increases your risk of heart attack, stroke, heart failure, and dangerous arrhythmias like atrial fibrillation. Walter's resting blood pressure when I first measured it was dangerously elevated despite being on 2 medications. His heart had begun to enlarge from the constant strain. He was on a collision course with catastrophe, and his only symptom was feeling tired and waking up gasping occasionally. The critical sign to watch for is this: if you wake up suddenly with a choking, gasping, or snorting sensation, especially if your partner tells you that you snore heavily or seem to stop breathing during sleep. This is not normal aging. This is not something to ignore. This is your body screaming at you in the only moment it can get your attention. But gasping awake is only one pattern. Let me tell you about Eleanor. She was 72, lived alone, and considered herself relatively healthy for her age. Eleanor started waking up 2 or 3 times per night to use the bathroom. At first, she thought nothing of it. She was getting older. She drank tea in the evening. It seemed like a natural consequence of aging. But over several months, the frequency increased. 3 times became 4. 4 became 5. Some nights she was up every 90 minutes, exhausted and frustrated, but assuming this was simply her new reality. When Eleanor finally mentioned this to her doctor during an unrelated visit, he ordered some tests that changed everything. Eleanor was in the early stages of heart failure. Her heart was not pumping efficiently, and during the day, gravity was causing fluid to pool in her lower legs. She had noticed some ankle swelling, but hadn't connected it to anything significant. At night, when she lay flat, that fluid redistributed throughout her body. Her kidneys, now receiving more blood flow in the horizontal position, went into overdrive trying to process the excess fluid. The result was frequent urination that had nothing to do with her bladder and everything to do with her heart. This symptom, called nocturia, is one of the most overlooked cardiac warning signs because it seems so explainable by other factors. Aging bladder, prostate issues in men, too much fluid before bed. But when you're waking up more than twice per night to urinate, especially if you've noticed any swelling in your ankles or feet, especially if you feel more short of breath when lying flat than when sitting up, Your body may be telling you that your heart is struggling to keep up with its workload. Eleanor's heart failure was caught early enough that medication and lifestyle changes made a dramatic difference. But she easily could have dismissed this warning for another year or two, during which time the damage would have progressed to a point much harder to reverse. The lesson here is critical. Frequent nighttime urination is not automatically a bladder problem. It can be a cardiac problem in disguise. Before I continue with the remaining warning signs, I want to ask for your help. If this information is valuable to you, please subscribe to this channel and turn on notifications. I create these videos because I've watched too many patients suffer from conditions that could have been caught earlier with better awareness. Subscribing helps me reach more people who need this knowledge. And please truly share this video with someone you love. You might feel awkward bringing up topics like nighttime urination or sleep problems, but that single awkward conversation could add years to someone's life. Now let me tell you about a warning sign that frightens people the most, and rightfully so. Richard was 69. He woke up at 3 in the morning with his heart racing so fast he could see his chest moving with each beat. He felt dizzy, slightly nauseous, and profoundly frightened. The episode lasted about 20 minutes and then gradually subsided. Richard told himself it was a nightmare, that he must have been dreaming something stressful. He went back to sleep and said nothing to anyone. 3 weeks later, it happened again, and then again a week after that. By the time Richard finally sought help, we discovered he was experiencing paroxysmal atrial fibrillation, episodes of irregular heart rhythm that were occurring exclusively at night. This pattern is far more common than people realize. During sleep, your autonomic nervous system shifts toward parasympathetic dominance, what we call rest and digest mode. For some people, this shift can actually trigger arrhythmias. The heart rate slows, electrical patterns change, and abnormal rhythms that stay suppressed during daytime activity suddenly emerge in the quiet of the night. Richard's episodes were not nightmares manifesting as physical symptoms. They were genuine cardiac events that happened to occur during sleep. If you ever wake up with your heart racing, pounding, fluttering, or beating irregularly, do not dismiss this as anxiety or bad dreams, especially if it happens more than once, especially if it's accompanied by lightheadedness, chest discomfort, or shortness of breath. Your body woke you for a reason. That reason might be keeping you alive long enough to get help. There's another nighttime warning sign that most people find embarrassing to discuss, so they stay silent about it until the situation becomes critical, waking up drenched in sweat. Not mild perspiration from a warm room or too many blankets. I mean soaking through your clothes and sheets, sometimes multiple times per night. Nighttime sweating has many potential causes, from hormonal changes to infections to medications. But there's one cause that rarely gets discussed: cardiac distress. When your heart is working too hard or not getting adequate blood flow, your sympathetic nervous system activates. This triggers sweating as part of the fight or flight response. Some patients experiencing nocturnal angina, reduced blood flow to the heart during sleep, wake up drenched in sweat without any chest pain whatsoever. The sweating is their only symptom. Night sweats can also accompany the arrhythmias I mentioned earlier. The sudden surge of adrenaline during an abnormal rhythm episode triggers immediate sweating. If you're waking up with unexplained drenching sweats, especially if you also feel your heart beating unusually or experience any shortness of breath, please do not assume this is hormonal or environmental without getting properly evaluated. The final pattern I want to address is perhaps the most subtle and therefore the most dangerous: waking up at the same time every night for no apparent reason. Traditional Chinese medicine has long associated specific waking times with specific organ systems, and while Western medicine approaches this differently, there is genuine physiological basis for consistent nighttime awakenings. Your body follows precise hormonal and metabolic rhythms. Blood sugar fluctuations, cortisol patterns, blood pressure variations all follow predictable curves throughout the night. When something disrupts these patterns, your body may respond by waking you at consistent times. Waking between 1 and 4 in the morning, for instance, can be associated with blood sugar drops, especially in diabetics or pre-diabetics. Waking consistently in the early morning hours with a sense of anxiety or doom can indicate cortisol dysfunction. The body is waking you because something has gone wrong with its normal nighttime programming. So what should you do with all of this information? First, start paying attention. Keep a simple note on your phone documenting when you wake up, what woke you, and any symptoms you noticed. Patterns become visible over time that are invisible in the moment. Second, communicate with your partner if you have one. Ask them what they observe while you sleep: snoring patterns, breathing pauses, movements, sounds. They witness things you cannot possibly know about yourself. Third, and most importantly, talk to your doctor. Bring your notes. Describe your patterns. Ask specifically about cardiac causes for your symptoms. Many physicians will focus on the obvious explanations unless you advocate for yourself and request thorough evaluation. Your body chose nighttime to send these messages because that's when it has your attention. The world is quiet, distractions disappear, and the signals that get drowned out during busy waking hours finally reach your conscious awareness. These nighttime awakenings are not random annoyances. They are not inevitable consequences of aging. They are communications from a body that wants desperately to help you stay alive. The question is whether you will listen. I encourage you to share your own experiences in the comments below. What wakes you at night? What patterns have you noticed? Your observation might help someone else recognize their own warning signs. And remember, this information works best when combined with professional medical guidance. Your doctor knows your history and can interpret these patterns within the context of your overall health. You now hold knowledge that most people will never receive. Use it wisely. Listen to your body. And please do not wait until whispers become screams.